What is MALS? An illustrated, animated guide by Potsy Spoons. This is me. Hi. I have MALS. And no, MALS does not stand for Marauders Always Lose Something. Darn it, Jeff, where's my taquito? I didn't touch it. Taquito. Macarons are lousy sometimes. You insult me. More art, less speech. I think it's a metaphor. I hope she knows it's a metaphor. Although, those all sound like much more fun. Except maybe that last one. I just can't tell. Ugh. I just can't tell if she can tell. Ugh. MALS stands for Median Arcuate Ligament Syndrome. MALS is a congenital anatomical anomaly, meaning a MALS patient's body is built differently. Maybe she's born with it. Maybe it's congenital. That's literally what congenital means. So, to really understand MALS, we need to look inside your body. I would rather you didn't. We all must make sacrifices for our art. Let's take a look. Your diaphragm. It helps you breathe. Your aorta. It comes from the heart. Aww. Your celiac artery. It branches off the aorta. Your superior mesenteric artery. It's not important to this video, but here it is. Your diaphragm is composed of muscles and ligaments, including the median arcuate ligament, which forms as you develop in the womb to create a hole for the aorta to pass through the diaphragm. Normally, the median arcuate ligament rests a few centimeters above the celiac artery. Nice, properly placed ligament. Happy little artery. In MALS patients, the diaphragm is too low, causing the median arcuate ligament to compress the celiac artery. Mean low ligament. Sad hooked artery. Between the artery and the ligament is a bundle of nerves called the celiac ganglion. When the ligament is too low, it compresses the nerves. Unsurprisingly, the nerves do not like being squished, so they respond as if they're under attack. They become inflamed and send faulty signals to the brain and body. Current estimates say that 15 to 34% of people have MALS anatomy, but of that number, only 1% experience symptoms. The 1%. Lucky us. Symptoms of MALS include nausea, vomiting, oh no, pain after eating, fatigue, often after eating, weight loss, this dress fit last week, and more. MALS symptoms often present as a GI issue, but MALS doesn't show up on GI tests, and because MALS is rarely known, patients may search years for a proper diagnosis. You are sick. Yes, that is all. MALS can be most accurately diagnosed with an abdominal CAT scan with contrast. However, because MALS is a rarely known condition, a doctor who is unfamiliar with it may still miss the proper diagnosis. This can lead a patient to many misdiagnoses. Common misdiagnoses include gallbladder issues. Many MALS patients have had their gallbladder removed. Irritable bowel syndrome. Chronic abdominal pain. This is a cop-out diagnosis, for the record. And eating disorders. Some patients, including children, are placed in eating disorder clinics. Many patients and their families fight for years to get a diagnosis, and many face gaslighting, discrimination, unnecessary and invasive tests, suspicion, and disbelief from a system designed to help and protect them. Don't get me wrong, our medical system helps a lot of people, but patients with rare or rarely known conditions often face an uphill battle trying to find a diagnosis. Many MALS patients are told that their pain is all in their head, but MALS is a structural anomaly, and the symptoms patients experience are very real. The pain associated with MALS has been likened to end-stage pancreatic cancer, but with very little emotional support or understanding. It's essential for us to raise awareness about MALS so patients can find answers sooner. and it's important for patients to have the support they need as they navigate a difficult diagnostic, treatment, and recovery process. Thanks for watching! Find more comics by Potsy Spoons on Facebook, Instagram, Twitter, and Tumblr.